Welcome students to our new YouTube channel Pharma X Tech, the division of excellence. So in the last video lecture we will see the introduction towards the cardiovascular system. So in the second we will see the drugs acting on the renin angiotensin aldosterone system from this cardiovascular system. So let's start to this topic, drugs acting on the renin angiotensin aldosterone system. So the renin angiotensin aldosterone system is primarily consumed with regulation of blood pressure, and also the initiation of the renin angiotensin aldosterone system is done by the secretion of renin from the juxtaglomerular apparatus of the kidney nephrons in response to decrease the flow rate of pre-urine in the distal tubules of the nephrons, and this is due to decrease the blood pressure in the glomeruli of the nephrons and following decrease the glomerular filtration rate. And also the activation of the renin angiotensin aldosterone system is done in 2 to 3 steps, and these steps are the angiotensinogen. In presence of renin it forms the angiotensin-I, and this angiotensin-I in presence of ACE it forms angiotensin-II, and this angiotensin-II forms the aldosterone secretion. So the most important functions of the renin angiotensin aldosterone system includes the angiotensin-II, in that the arterial vasoconstriction, this is primarily in the kidneys, heart and brain, and also the increased sympathetic tone, and also hypertrophy or hyperplasia of cardiac and smooth muscles, and also in angiotensin-II there is aldosterone secretion. And next we see the aldosterone, in that the sodium water reabsorption by the kidneys and potassium secretion by the kidneys and potassium uptake by the cells of the body, and also the hydrogen ion secretion by the kidney, that means pH regulation in aldosterone. So next we see the drugs of this renin angiotensin aldosterone system, in that the first one is beta 1 adrenergic receptor antagonists. These beta 1 adrenoreceptors are found in the macula densa cells of the juxtaglomerular apparatus and facilitate the renin release upon activation, and the beta 1 adrenoreceptors antagonists thus inhibit the renin release. The next drug is of beta 1 adrenergic receptor agonist is metoprolol, and the clinical uses of this metoprolol is in the treatment of hypertension and also in the treatment of cardiac dysarrhythmias and also in the treatment of angina pectoris. And the side effects of this metoprolol includes it has same side effects like propranolol, though the less pronounced bronchoconstriction. So this bronchoconstriction is the side effects of metoprolol. So next we see the renin inhibitors. The renin inhibitors inhibit the enzymatic activity of the renin, thus the decreases the conversion of angiotensinogen to angiotensin-I. So next we see the ACE inhibitors. These ACE inhibitors inhibit the enzymatic activity of ACE, thus decrease the conversion of angiotensin-I to angiotensin-II. Next we see the drugs, in that enalapril and lisinopril. The general points in enalapril and lisinopril are it administered orally and they are prodrugs of each other, and also the extensive first pass metabolism, that means conversion to active metabolites. So next we see the uses of this enalapril and this lisinopril. This is used in the treatment of hypertension, that means arterial vasodilation and decrease the sodium water retention, and also in prophylaxis of angina pectoris and AMI, coronary artery vasodilation. And also in the treatment of cardiac failure, that means coronary arterial vasodilation, decrease hypertrophy or hyperplasia of the cardiac muscle and decrease the preload or afterload. And also this is used in the treatment of chronic and acute renal failure, that means the decrease the workload of the kidneys. So these are the uses of this enalapril and lisinopril in the hypertension, prophylaxis of angina pectoris, treatment of cardiac failure, and also in the treatment of chronic and acute renal failure. So next we see the side effects of this enalapril and lisinopril, and the side effects includes hypotension, renal failure, in that renal ischemia if bilateral renal artery stenosis is present, and teratogenesis, hyperkalemia, the decreased potassium secretion and cell uptake, and also the respiratory mucosal edema, in that the ACE is also responsible for catabolizing the bradykinin, and also the side effects like dry cough, that means in respiratory mucosal edema. So the next we see the type 1 angiotensin II receptor antagonists. These type 1 angiotensin II receptors are found in both arteries and renal tubules, and they are the primary receptors for angiotensin II action. And also the type 1 angiotensin II receptors antagonists are competitive antagonists of angiotensin II at type 1 angiotensin II receptors, thus they decreasing their activation. So next we see the drugs in type 1 angiotensin II receptor antagonists, and they are losartan and valsartan. So let's see the some general points about this losartan and valsartan. These losartan and valsartans, they are administered orally, and the uses of these losartan and valsartans, they are used in the treatment of hypertension, that means arterial vasodilation, and decrease the sodium water retention. And the side effects of these losartan and valsartans include, it is same as with enalapril, but there is no respiration mucosal edema or dry cough. So next we see the aldosterone receptor antagonists, that means potassium sparing diuretics. So this aldosterone receptor antagonist is also known as potassium sparing diuretics. So there is may increase urinary output to 5 liters per day, that means 3% of glomerular filtrate. And also the potassium sparing diuretics antagonists the effect of aldosterone in the late distal tubule. So, and the drugs like spironolactone in aldosterone receptor antagonists, and the general points of the spironolactone, that it is the direct antagonist of aldosterone at the intracellular aldosterone receptor in the late distal tubule, thus the inhibiting expression of aldosterone dependent sodium reabsorption and potassium and hydrogen ion secretion. And the spironolactone is administered orally. So next we see the uses of this spironolactone. This is co-administered with the non-potassium sparing diuretics to preserve the potassium. And also this spironolactone is used in the treatment of hyperaldosteronism, that means in Conn's syndrome. So in GPAT there is a question that which drug is used in the treatment of hyperaldosteronism, and the right answer is spironolactone. And also the reverse question is asked, the spironolactone is used in the which disease treatment, and the right answer is hyperaldosteronism, that means Conn's syndrome. Next we see the side effects of this spironolactone, and the side effects include hyperkalemia, that means decrease in potassium secretion, and also the metabolic acidosis, that means the decreased hydrogen secretion and hyperkalemia. And also in testicular atrophy, impotence, gynecomastia, and amenorrhea. These are the side effects of these spironolactones. It includes hyperkalemia, metabolic acidosis, testicular atrophy, impotence, and gynecomastia and amenorrhea. So next we see the triamterene and amiloride. So the general points of this triamterene and amiloride are they are indirect antagonist of aldosterone by blocking the aldosterone dependent sodium reabsorption and potassium secretion, and these drugs amiloride and triamterene they are administered orally, and the uses of this amiloride and triamterenes are they are co-administered with non-potassium sparing diuretics to preserve potassium, and the side effects of this triamterene and amiloride includes the hyperkalemia and metabolic acidosis due to the hyperkalemia. So next we see the last angiotensin receptor blockers, and in that the losartan, valsartan, irbesartan, candesartan, telmisartan, all these sartans are the angiotensin receptor blockers, and also ipresartan they acts by antagonizing the action of angiotensin-II at T1 receptors. These drugs do not increase the bradykinin and thus have less chances of causing the cup and angioedema. The angiotensin receptor blockers acts at a distal site, so these will inhibit the activity of renin angiotensin system when angiotensin is generated by non-ACE pathway, and due to this reason the angiotensin receptor blockers can be combined with ACE inhibitors for various indications, and the losartan results in the production of active metabolites in the liver. The losartan is also a competitive antagonist of thromboxane A2 and attenuates the platelets aggregation, and these all indications, adverse effects and contraindications of ACEI also apply angiotensin receptor blockers, and except that the incidence of cup and angioedema is less with angiotensin receptor blockers. So in this way we complete this topic, drugs acting on renin angiotensin aldosterone system. So in that we see the uh, activation of renin angiotensin aldosterone system steps, and also the angiotensin-II aldosterone, and also the drugs used in this aldosterone system. They are beta 1 adrenergic receptor like metoprolol, renin inhibitor, ACE inhibitors like enalapril, lisinopril, and their uses, general points, and also their side effects, and also the type 1 angiotensin-II receptor antagonists like losartan and valsartan, and also the aldosterone receptor antagonists also known as potassium sparing diuretics. In that the drugs like spironolactone and their uses, and also triamterene and amiloride, and at last we see the angiotensin receptor blockers like losartan, valsartan, irbesartan, candesartan, telmisartan, and ipresartan. So all the sartans are angiotensin receptor blockers. So in this way we complete this chapter. So please share this video more and more to your GPAT aspirants as well as CT aspirants. So thanks for watching this video. Hope you like this video. Please, if you like this video, please comment on comment section, and also like this video, and also share this video, and also like, share and subscribe to our channel. And thanks for watching this video. Thank you for watching. Stay updated with this pharma extract and stay tuned for next video. So thank you for watching. Stay tuned.